So a secret to passing your CNA board exam is to practice. Practice, practice, practice. Do as many practice questions as you can, okay? That's why we came up with these question banks. I'm gonna link my website so you can go ahead and order yourself. We have more than 600 questions practice bank where you can go ahead and practice. Question number 1 of the following are ways to prevent pressure sores, except what? So you're like, oh, pressure sores prevention. So you would think they're asking to you how to prevent pressure sores. No, they're looking for the wrong answer in here. Okay. So you have 4 answers. 3 are going to be correct. 1 will be wrong. So 1, regular positioning. 2, providing extra blanket. 3, changing soiled sheet quickly. And 4, avoiding wrinkles in the sheet. Okay. So regular positioning. That's correct. You want to reposition your patient every 2 hours. Changing soiled sheets quickly, exactly, because moisture will cause skin breakdown and it can lead to pressure injury. 4 says avoiding wrinkles in the sheets. Yes, when there are too many wrinkles, it can actually create pressure on the skin as well and create skin breakdown. So which one is incorrect would be number 2 that said providing extra blanket. So blankets don't prevent pressure injury. Turning, dryness, and smooth linens will do prevent pressure injury. Okay, that makes sense, right? 2 would be making a bed occupied or unoccupied should end with what? So making a bed. It's not asking you about how you make a bed. You know how to make a bed. But it's asking you when you're done making the bed, what is your final action? Okay? Number 1, washing your hands. 2, metering the corners. 3, adjusting the bed height. And 4, moving the call light. So think about it. The correct answer would be what? 1. So the last step, that's the last, it's asking for the last step that you do. Of course, you're going to meter the corners. Of course, you're going to adjust the bed height. If you had it high for your comfort of your back, then once you're done, you put it all the way to the lowest level, right? Of course, you're going to move the call light to the patient. So they have to have the call light. But the last thing you do before leaving the room is to wash your hands. So last one would be, which is the least likely to signal impending death. So your patient's dying, you have a hospice patient, patient is dying. So they're asking you which one is not a sign of a patient is dying, like in the next 6 hours, the next 1 year, one day. So 1, labored breathing. 2, increase in appetite. 3, unstable blood pressure. 4, cold extremities. So the question is asking which one is not correct. So your patient's dying, labored breathing will be correct, right? They can breathe properly. Unstable blood pressure. The blood pressure would be in the 80s or the 60s or the 40s. That's correct. Cool extremities. Yes, the extremities get cool when they're dying. So increased appetite is the correct answer. But you see how tricky